Hi, today I'm here with Dr. Philip Bamley from Solon Orthodontics. You come in for a complimentary consultation, and for us, if it's the first time we're doing it, we're kind of like, I don't know what questions I should ask. So what are the questions that I'm sure you have things that you give to parents, and then you kind of say, do you have any questions?
The three questions that they're mostly looking for when they come in are, what sort of treatment might be involved, how long will it take, and then about insurances and costs, those kind of things. Those are the three kind of standard ones that they really are looking for when they come in for a consult. However, you also you want to make sure they know, like, okay, what they're getting into, right? So what it's like with life with braces on, what sort of foods should be avoided, how should you alter, maybe not so much what you're eating, there's some of that, but more of how you're eating it. A good case in point is carrots. Maybe instead of eating raw carrots right there, which are really hard, they're great for you and we don't discourage that. However, you may want to have shredded carrots or cooked carrots, things that are softer or just a different uh, texture, or not as hard, those kind of things, so that you can still eat those items, but just maybe not the way you used to without braces on. We always go over options. Invisalign isn't always a treatment option, but sometimes it is. So a lot of folks do know about that. There are a lot of times they come in kind of looking for Invisalign per se, and then they say, well, you gotta really, though, the best way to do your treatment is maybe with braces. It just depends on what the case presents as and what sort of tooth movements are necessary. But again, just things of kind of gauging their comfort level with the practice, and where they're going to be going for the next quite some time, if you will, and just so that they're comfortable with their ultimate decisions, like you said.
Okay, well, so Dr. Bamley does not like to talk about himself. So I asked someone that works for him to talk about him. And what I want to tell you is, which I'm sure you can tell already, he's the reason that the office is a nice place, because he sets the tone. And the people that he hires also have the same philosophy. So from beginning to end, you will feel respected. Your kid will feel respected if your kid is the person he's working with. And so just overall, an environment that I think we should all expect, but don't always get. So thank you for that. And then I want to ask you, there are kids who struggle in life in general, that going to the orthodontist would be more challenging. They have sensory issues. They're phobic about things. They might be on the spectrum. Is that something that you handle? You have protocol for it?
Yeah, and it's just even like one more step further than we do for anybody else. We actually have a brand new office we just got into about a month ago now. When we designed this place, we now have 3 private treatment rooms, and that can be nice sometimes, a little quieter area for somebody who may have some sensory issues, those kind of things. But at the end of the day, it's all about again, speaking that person's language. If it means going slower, if it means separating out things and appointments that we might do in one appointment, in certain circumstances, maybe it's 2 appointments and you just do a little bit, and you don't want to overwhelm the patient at any point in time. So maybe you make appointments longer, maybe you make them in times of the day that are a little bit less crazy busy, those kind of things, to help that person feel more comfortable with the treatment that they deserve.
What's the relationship between the dentist and the orthodontist?
Teammates, right? You've got to be on the same team. We pretty much every patient that we see, or most of sometimes when they come to us, they maybe just moved and they don't have an established general dentist yet, but most folks that we're seeing have a general dentist. If they don't, I make sure that they see a general dentist before we're comfortable starting treatment on them, because I want to make sure that they start off with a clean slate. There's no cavities, there's nothing that's a concern from a general dental perspective before we start moving their teeth around. So they certainly will by the time we get started. But again, we're teammates, right? Like I have to help them do what they're trying to do, and vice versa. Again, we got to be on the same plan.
Last question. What are you most proud of with your practice?
That the trust that we've earned and gained with patients and their families and the community just is, you can't, it takes a while to get that. And that's what makes me proud. When we have families coming back and recommending their friends, other family members, people trust us.
Dr. Philip Bamley from Solon Orthodontics, thank you so much for being here with us.
Thank you for having me. I appreciate it.